which is a good thing you can read. Hey, my name is Caitlin Wynn. I have my ID badge from work as I do not have my Seneca ID. My first name is spelled Caitlin and my last name is Winn. I'm going to do a quick 360 of the room that we are filming in. I am using a tripod to film. Okay. All right. Hello, how are you?
Good, thank you. How are you?
Good. So upon the initial assessment of my patient, their vital signs are, they have a fever of 39.7. I would treat with Tylenol if there was an order for Tylenol. If not, I would obtain an order. Their heart rate is increased at 115, so they are tachycardic. This could be related to pain or it could be related to some form of infection. They're also slightly tachypnic with a Resp rate of 22. Again, also could be related to an infection or signs of pain, and blood pressure is within normal limits. Are you having any weakness?
No.
Are you having any tremors?
No.
Any seizures?
No.
Any numbness or tingling?
Nope.
Are you having any difficulty with swallowing or speaking?
Nope.
Any headaches?
Yes, and my neck is really stiff.
Okay, any recent head injury?
No.
Any shortness of breath?
Yes, I feel dizzy and it's making me feel nauseous.
Okay, are you having any cough at all?
Yes, I have a cough, but it's not too bad.
Okay, and with that cough, are you experiencing any chest pain?
No, but my chest hurts a little bit.
Okay. When did the pain start?
A day ago, and it's worse than today.
Okay. Is there anything that provokes your pain?
Movement and light.
Okay. And what is the severity of your pain?
The worst, 8 out of 10.
Okay. And are you, can you describe the quality of the pain?
It's throbbing.
Okay. Is the pain radiating?
It doesn't spread, I just feel fatigued, tired, and dizzy.
Okay. And how often is the pain occurring?
All the time.
Are you treating the pain at all?
I have tried taking Tylenol and Advil, but it didn't work.
Okay, and with these current symptoms that you're experiencing, do you have an idea of what may be going on with you?
I don't know, I just feel sick.
Okay. So I would perform a neuro assessment of my patient. So I'm going to utilize this. So I would have them follow the object. So I'm just gonna bring this object towards you. As I move it, just follow your eyes naturally. Good. This side. And we're gonna go to the side. Perfect. I would then utilize a pen light to check their pupils. So that is what I would do. Shine that in either eye. The patient's pupils are equal, round, and reactive to light. I'm next gonna have you grab onto my fingers. I'm gonna have you squeeze both hands. Squeeze, squeeze, squeeze as hard as you can. Perfect. I'm gonna check your range of motion. So I'm just gonna have you lie back for me. Okay, I'm just gonna have you bend this leg up and back. Good. And this one, up and back. Perfect. And I'm just gonna have you lift one leg at a time to touch your feet. Good. The other one. Perfect. You can go ahead and you can sit up. At this point, I would now do a respiratory assessment on the patient. I'm just gonna take a little listen to your chest. Is that okay with you?
Yes.
Okay, I'm gonna listen to the front. Every time my stethoscope touches your chest, just have a nice deep breath in for me. Okay. Deep breath. Deep breath. Good. Deep breath. Deep breath. Okay. And one more time. Deep breath. I'm just going to listen to the back of your chest now. And again, every time you feel the stethoscope, just take a nice deep breath. Deep breath. Yep. Good. One more. Good. So upon my assessment, I can obviously see that my patient is well. They are in no signs of respiratory distress. There's no increased work of breathing. They are not cyanotic. Upon assessment, the patient's lungs are clear. However, in this possibility, you could possibly hear some crackles or some wheezing with the cough that they have been having. And then from here, I would do my S-bar to a physician. So the situation is a 17-year-old male that has presented to the emergency department with dizziness, headaches, weakness, and feeling unwell. With the signs and symptoms that they're experiencing, they could possibly be experiencing meningitis. I would obviously confer with an MD or possibly a nurse practitioner and have them perform an assessment, which could include a lumbar puncture, some further blood work, possibly a chest x-ray.